All right, well, we are going to follow up our rainy winter with a sneezy spring, and this is expected to be one of the worst allergy seasons in recent history, in memory rather. To talk about this now is Dr. Marc Kerner. He's an ear and nose and throat and neck surgeon with Calwest Head and Neck Surgical Institute. Thank you for coming in early this morning. Great to see you. I feel like I'm about to sneeze. All right, so are you seeing a lot of patients come in now with allergies?
Right. As great as it's been that we've had so much rain now, we're also seeing a ton of allergy now. And so with the pollen counts and the trees and all the bloom, the allergy problems are just gone way up.
Yeah, and we expect, because I see everything blooming, everything's green. How can you tell the difference between a cold or allergy or sinus?
Sure, great question. Well, basically allergies are systemic, so people will suffer with allergy symptoms including runny eyes, itchy eyes, runny nose, postnasal drip, and all the sort of systemic symptoms where they may feel fatigued and have some low-grade headaches. And then when it specifically affects the sinuses, they'll end up with basically nasal congestion, unable to breathe through their nose, and then just persistent congestion.
Okay. So a good way to tell it. Are there any tests that can be done for all of this?
Sure. A lot of this can be done by just a physical examination. Most people just treat themselves using over-the-counter preparations, and almost all the medications now are over-the-counter for allergies as well. And then when it gets to a point where they just can't control that, that's where your doctor comes in, and the doctor can actually examine you and figure out whether it's become just an allergy issue or has progressed to a sinus infection.
Okay, and I know I've done that. I know a lot of people have gone there. You actually do tests where you can do a little skin test on the skin.
Yeah, so for allergy testing for the people that are really suffering, we can do both skin testing and blood testing as well.
Great.
And then in terms of where people are progressing into having colds that go into sinus infections, we can examine them excuse me, with scopes and stuff to determine whether they have either an acute or chronic sinus problem.
Okay, great. And what should they do if they have a cold versus allergy or a sinus infection? What should people do? Sure.
Well, again, the over-the-counter preparations, one of the biggest things that we have people do is nasal irrigation with just saline.
Sure.
So that's a homeopathic regimen that actually works very, very well.
You can use that almost every day, right?
Every day, yes. And we have people do that every day, and they get a lot of relief from that.
Yeah, that makes sense. And even if you don't have the allergies or you're out working in the yard, I know a lot of people tend to use that nasal spray, the saline spray.
Exactly. Tends
to help things up. And when does someone need to know if they need surgery or, if this is one of these sinus infections we've been talking about?
Well, there's a lot of steps before that even. So the first thing is really to treat them medically aggressively, if they're having recurrent infections, we'll put them on antibiotics, we'll put them on the nasal sprays and irrigations, and then we'll get a CAT scan to delineate exactly the extent of the infection and the process. And then we now have a number of solutions that are minimally invasive. We have a balloon sinuplasty technique that's like angioplasty of the sinuses that's very effective for people with moderate allergies who have recurrent sinus infections but don't need full-blown surgery.
Okay. Is that one of the newer methods, one of the newer surgeries?
Absolutely. It's one of the newer techniques that have been developed and that we've been using now for a number of years.
That sounds awesome.
That's great.
It's this time of year, like you said, you expect it perhaps to be a little more intense. And are you seeing that it's coming in a little bit later since we had the rains last so long?
Well, it's been both, basically. I mean, because we had the rains early, too. So now we're seeing just such a pollen bloom that people who really have problems are having problems now.
It's true. And when I put rain in the forecast, people are excited because it tends to wash out some of the pollen. However, yeah, it's one of those things we need to watch carefully. Thank you for coming in, because this is great information. A lot of people are sneezing and don't know the difference at times.
Great. Thank you for having me.
Thank you so much. All right. So to learn more about Calwest Head and Neck Surgical Institute, you can go to kcal9.com, click See It on TV, and we will be right back.